Have you been suffering from pain due to a herniated disc? Well, if you were looking for relief, our next guest says he can help. This is Dr. Alex Bingham of Novocur. Great to have you here, and you deal and treat all sorts of pain. But specifically, what is a herniated disc?
So one of the most common causes of back pain and neck pain, we have these cushions in between each of the spinal vertebrae in our back, and they're commonly injured in the lower back or in the neck. We can see an example of a normal disc, and this is the top view on the left in this graphic, and we can see that the construction of a disc is kind of like a jelly donut, where there's a gelatinous center and there's a harder outer portion, and you can see a cross-section of the spinal cord and the nerve roots on the back side of it there. Now on the right side, we see an example of a herniated disc, or a slit disc as people commonly call it. And you can see how the gelatinous center is working its way out through the back and beginning to compress some of the nerve tissue back there, which is why frequently when you have a herniated disc, if it's in the low back, you might have radiating pain going all the way down to your foot sometimes, but it'll always be lower than the knee. And if it's in the neck, you might have radiating pain down an arm, or you might have weakness in your grip strength or something to that effect.
And it just affects your entire body.
Right.
So when patients come to Novocur, what is the first step in treatment?
So once they've already tried conservative treatment like chiropractic care, physical therapy, and that has failed, because those will often fix this. If that has failed, we're going to do something simple called an epidural steroid injection. We're going to take just a little bit of an anti-inflammatory medication, and you can see on this graphic here, we're going to insert the medication right behind the area of the herniated disc, and that very frequently and very quickly can reduce the inflammation and the pain.
All right, and you guys also now offer a regenerative treatment. Explain that.
That's the latest and greatest in interventional pain, is where we can take proteins or different products from your own body. For example, venous blood. We can take your venous blood, we can spin it down in a centrifuge, and we can isolate something called alpha-2 macroglobulin, which is a mouthful, so we call it A2M. We can insert that A2M protein into the middle of the disc, and it pretty much instantaneously reduces the inflammation that causes the pain. Then we'll take another product from your blood called fibrin, and we'll patch the area that's torn on the disc on the backside. It's almost like patching a tire inner tube, so the contents can't continue to come out. It is amazing.
It is amazing. So how is the A2M different than traditional methods?
Well, for one thing, we're using your body's own product, so we're not using any medications from the outside. We're just using natural things that we find in your own body, things that we can use to heal the problem.
And so what if these treatments, because I mean these are not surgeries, but what if they don't work? What do you offer at Novocur?
Right. You know, what's interesting is this A2M very frequently saves people from going to surgery, because usually if we do a series of epidurals that doesn't work, the next thing is that they're going to go to a spine consult to see about possibly having surgery. We are affiliated with one of the best spinal surgeons in the country, and if there's anything minimally invasive that can be done, we can do it at Novocur. So that would be the next step.
So you have all of this under one roof.
All under one roof, from A to Z.
So the goal here is to get pain relief.
Right.
So come and visit you and find out what is the best treatment option for you.
Yes,
thank you so much, Dr. Bingham. We appreciate you. Novocur, they have locations in Scottsdale and in Chandler. To make an appointment, call 480-855-6686 or visit the website novocur.com.